Hi, we're here live with Dr. Jennifer Reynolds, and I'm Katie LeBlanc. I'm with the Arthritis Patient Advisory Board in Vancouver, and we're here live at the CRAs, and we're having an awesome time interviewing a lot of the presenters here today. So we're going to talk to Jennifer a bit today. She's a clinical assistant professor at the Department of Medicine in Providence Healthcare in Vancouver. So Jennifer, can you just tell us a little bit about yourself and how you're involved in the field of rheumatology?
I can. I am one of the adult rheumatologists at Mary Pack Arthritis Center, which is just near VGH. I do a combination of private practice there and then the lupus clinic.
And we know that you have a presentation coming up this week on Saturday. Can you give us a bit of a sneak peek and some key takeaway messages from your talk?
Sure. So my title of my talk is Mistakes in Lupus, and it's not so much about errors in terms of treatment and things that the physicians make because they don't know what to treat. A lot of the cases that I'm talking about where things didn't perhaps go as well as everyone wanted, it was mostly to do with errors in communication. And so really trying to, my big message from the talk is the importance of really good communication. And for each of the cases, it's different types of communication. So sometimes it's between the different specialists or the other physicians. So some of the patients get transferred between different hospitals, and it's not always clear what's happened before. Sometimes it's the patients themselves not communicating very well, either to me in my office or to other physicians who get presented. And then sometimes it's the communications back, obviously, from me or some other caregiver to the patients themselves. So each of those, in a different way, has caused a problem for some of the management.
Right, and do you have any ideas of how to maybe fix that problem?
I think sometimes awareness makes a huge difference. I know in my practice that I have the luxury, in my lupus clinic, I have a nurse that works with me who's done a lot of education sessions with patients and is really good at keeping track of what patients really understand and maybe what their questions are. And she's really approachable, which is lovely. And some of the outside rheumatologists in private practice obviously don't have time to do that. So that's a luxury that, and one of the things that we really try to do in lupus clinic is patient education. And making sure the patients understand that lots of times they know as much or more about their disease than some of the physicians that they might encounter in places because it's such a rare disease. And that things that they say really do influence their care.
Right, so just advocating for them to trust
their instincts,
yeah.
and sort of be forthcoming with that information. And if you hear something back that you're not so sure about, question it. Most of the time there's other people available. If you can't get in touch with your rheumatologist, your doctor could get in touch with another rheumatologist. And I think because lupus is such a rare condition, that it's really important to have someone involved in the care who really understands and sees a lot of lupus.
Right. Okay, and can you just give a brief introduction of what lupus is and
sure. So
how it differentiates from other types of arthritis?
So lupus is an autoimmune disease. Lots of arthritis conditions are, but it doesn't just attack the joints. It's very, very variable in terms of who it, when it affects people, they can have different organs get attacked. The most common things that we see in patients with lupus would be skin manifestations, so skin rashes, inflammation in the skin, lots of arthritis, inflammation in the joints themselves, but they can also have inflammation in the kidneys and the heart and the lungs, the brain, pretty much anywhere. Sometimes you'll have one organ or a specific area be a real problem for a patient going forward, and they really don't have a lot of other manifestations. And then other patients can have everything all at once. Some patients have one, and then a few years later they'll have something else. So it's one of our most variable inflammatory diseases. The Canadian Network for Improved Outcomes in Lupus had a study called The Disease of 1,000 Faces, because really each individual lupus patient has their own disease course.
And yeah, different manifestation. So what can patients do to help their friends and family understand lupus?
It's hard because a lot of times lupus patients don't look unwell, even when they do have a lot of inflammation. It's very internal. If the skin is involved, that can be on the other extreme, is something that's always present and really bothersome to them. But a lot of lupus patients really suffer with fatigue, low energy. They're taking medications that might make them feel unwell. But if you saw them on the street, you'd never know that they had an illness. And so I think really having that open communication with your family and your friends and explaining to them that even when you look well, you might not feel well, and asking instead of assuming is always a good thing. Some of the patient support groups actually have some really good information online. So I know the UK British lupus patient support program has some really good YouTube videos that explain what it's like and talk about ways to talk with your friends and your family, so other people have ideas.
Yeah, I think a lot of patients like us can relate to feeling the invisible disease and trying to explain it over and over again. So what do you think is the most important and exciting thing coming from this year's CRA?
Well, it's when we just started, so
Yeah.
hopefully there's lots more still to come. I really enjoyed the session we had yesterday about exercise as medicine and how to encourage patients to get out and be more active, and really the benefits for them, less joint inflammation, more energy, all the things that we hear that are really difficult to live with on a daily basis really can be improved by being more active, and that there's good solid evidence behind that. It's not just a catchphrase at the moment. So I really enjoyed that session. Hopefully will translate into practice.
So what do you think about the use of social media in relation to patient care and medical research, and what we're doing today, making things more available to the public?
I think social media has a lot of power behind it in terms of being able to reach so many people. I think everyone's using it, so putting some really good information out there for people is really attractive. As a physician, I get nervous about it because of privacy issues, so I can generally say things like we're talking about today, but in terms of actually interacting with an individual patient, I don't think we're quite there yet. There was a really lovely session at lunchtime, and they talked about all the various apps that are out there. So I think for patients trying to advocate for themselves, there's health apps and step counters and things like that that we can use to try and make yourself more healthy. And so that's also really powerful. There's some talk about being able to use it to recruit patients for research, which is also a nice way to reach a broader group of people. So in terms of our research studies, we tend to recruit just from our clinics, but there's probably a lot of people out there that would be interested. That would be another way of getting it.
Okay. And so where do you see arthritis treatment and models of care and healthcare going in the next 10 years or so?
In terms of treatment, there's lots of new medications coming down the pipeline for lupus, so I'm really hoping that some of those succeed in meeting their goals and that we actually do have some new treatments available. We did have another medication come out a few years ago, and there was a lot of issues with cost, and so it's not actually been as useful for me on an everyday basis. But I'm hoping some of that other companies might have learned from that, and we might get some actually more readily available medications that we can use. In terms of models of care, I think with our aging population and other types of arthritis becoming such more of a burden, osteoarthritis and that sort of thing, I think we're going to have more multidisciplinary kind of approaches. Clinics that have nurse practitioners and that kind of thing, and some of the technology stuff too. Like you may be able to do follow-up visits over video conferencing or social media.
Right. So yeah, bring you back to what you said earlier about opening the lines of communication further. And so to conclude, what type of lifestyle tips do you have to offer for our audience?
I think most of the time in clinic, what I end up offering or suggesting to people are really bread and butter things. I sort of laughed. It's all what your mom told you to do. Get lots of sleep, and there's good evidence for lupus patients that if they get adequate rest, that their disease activity actually can go down. And I have patients who just increase the amount of sleeping, and they can settle a mild flare with that. I think eating really well is important. I know lots of patients ask me about specific foods, but I think a lot of us could have a better overall healthy diet, eat more vegetables, all of that kind of basic stuff. And then back to what I was talking about before, that whole exercise is medicine thing. taking good care of your body, being more active on a daily basis, but also increasing your fitness.
Right. Those are all amazing
Bread and
tips.
butter.
Back to the basics.
Yes, absolutely.
Are there any questions from our audience?
Yeah, we have one, I think, that tags on nicely to what you were just saying, Jennifer. And this person wants to know, what specific types of exercise is good for lupus patients? You know, is there one type of exercise that's better, or is it a variety of types of exercise? I think this is where patients normally get lost.
It's hard. I think the evidence shows that you don't actually have to be as active as we think of in terms of exercise. That, you know, we had our session that moderate physical activity actually has a lot of health benefits, and that's not even, it's going for a walk, but not even a really brisk walk, but just getting out there more regularly, sort of 30 minutes a day is the recommended amount, and I think that that's got the best evidence for most kinds of arthritis. I haven't seen anything more specific for lupus patients. I know for all of my patients, as they get older, I also worry about balance and risk of falls, so I'm frequently telling my patients to make sure that they're including some strengthening, stretching kind of exercises as well. Especially if they have arthritis, a lot of that stretching exercises in the morning can really help loosen things up and get moving.
All right, so I think that wraps it up. Thank you so much, Jennifer, for talking to us today, and enjoy the rest of the